My name is Michael Warner. I live in England, in Oxfordshire, and I wanted to just share with you a few slides and a video on a topic to do with the COVID-19 crisis that has resonated with me. And I'm not sure that many people are aware of what I've been learning the last 2 days. So it's a short video from Dr. Price, who's in the intensive care unit at the main New York hospital combating the COVID virus and helping the patients there. And he's sharing a video with his family that he's put online, explaining how his family can protect themselves. And the new perspective that I wanted to share with you is the importance of wearing a mask when you're outside your house for the primary purpose of helping to stop you from touching your face, which from his experience is the primary vector for catching this disease. So here is Dr. Price, and he has three main messages. Obviously, we know these: stay 2 meters away from others, know your hands are clean, washed with soap and water, or if you have a sanitizer after touching objects that might have been touched by others. But it's this third one that I wanted to draw everyone's attention to. When leaving your house, wear a mask so as to not touch your face, period. Here's the video from Dr. Price.
The reason I want to have this call is because I don't want you guys to be scared. We're 3 months into this in the medical world, and we understand this disease. And so I'm going to go through kind of ways to protect your family, and then what to do if and when, given the size of this call, it's a when, someone gets COVID, and how we can protect our circle. You may hear a little inflection in my voice, like I'm emotional. It's not because I'm scared. It's actually the opposite. For the first time in a while, I'm actually not scared. And so I'm going to share with you why that is. So just a quick introduction as to what's going on in New York. I work at probably the premier hospital in New York City. It is a 1,200 bed hospital. We do everything from surgery to transplants, lung transplants, heart transplants. At this point, we do none of that. Almost none of that. Our hospital is almost exclusively a COVID-19 hospital. And so people enter through a secure gate in the front, where in the past, what I've been doing is seeing old people with pneumonias or seeing people with bleeds. Almost exclusively what I do all day long is see people with COVID-19. But we're learning and we know a lot. And what I want you guys to know is that every single day we're getting better. We know more. And I am confident that the stuff I can tell you today should make you guys feel like when this comes to your community, that you don't have to be scared and that you can protect your family. So I think the first thing is, how do you get COVID? And I think that this is really important, and we've really learned a lot over the last couple of weeks to months about how you get this disease. And so the overarching theme is sustained contact with someone who has this disease, which the vast majority is people with fever and aches, or someone who is about to get the disease. So someone in the next 1 to 2 days who's going to develop symptoms of this disease. And so the way that you get this is the transmission of the virus almost exclusively from your hands to your face. From your hands to your face. And so it's either into your eyes, into your nose, or into your mouth. So there's a lot of talk about contact or getting it through contact, hands to face. There's also a small thought that it can be aerosolized, that it can kind of exist a little bit in the air. The thought at this point is that you actually have to have very long, sustained contact with someone. And I'm talking about over 15 to 30 minutes in an unprotected environment, meaning you're in a very closed room without any type of mask, for you to get it that way. But to very simply state, the overwhelming majority of people are getting this by physically touching someone who has this disease or will develop it in the next 1 to 2 days, and then touching their face. And so that actually, I think, is incredibly empowering. And that's, as I've been in the hospital the last 2 days, the thing that makes me smile a little bit is that I actually know now that I won't get this disease because I know how to protect myself.
So there's the message from Dr. Price. My understanding of what he's saying is the reason for wearing a mask, the ones that we've heard most about, may be beneficial, although the WTO advice has not yet caught up with that. The idea of preventing you from catching it from the aerosolation, as he was describing it, droplets in the air, or preventing, if you have had it, from when you cough and sneeze, other people catching it. But this third reason for wearing a mask, the one about helping you to not touch your face, I don't think has come across strongly enough, and is why I wanted to make this video. So this is the last piece in the video where he was saying, look, if you want to make yourself a mask for the purpose of helping to prevent you touch your face, then you don't need an N95 mask or other type of medical mask. Any mask will do in the context of a mask to help you not to touch your face. And if you do that, then the limited supply and availability of the medical masks can continue to go to the care centres and the hospitals and emergency services which so badly need them. Quick disclaimer, nothing you're going to see in the next few slides has any clinical testing at all. It is just common sense that if you want to make yourself a mask that might help you stop touching your face, then here is one way to do it. T-shirt, scissors, pen, and a straight hard edge, some sort of book, something like that. Preferably a clean t-shirt would be a good idea, wouldn't it? So lay the t-shirt out flat, and you're trying to create 3 separate strips, which will give you 3 masks per t-shirt. This was one of my favorite t-shirts, actually. It was really new. It's from Crew, and quite sad to see this one go, but I thought it was important to take a reasonably good t-shirt and not something with some horrendous rude slogan on the front. So I've taken a nice white t-shirt, in this case it's a cotton t-shirt, and laid out 3 equal heighted panels, strips across. Put the cutting lines, mark out the cutting lines front and back, and as a quick tip, if you look to the bottom right, you'll see that I turned it over and tipped over the edges of the front side, which I'd marked, and then that gave me a left and a right that I could put this book across, or obviously a ruler if you have it, and line them up. So now you have lines front and back which are matching each other, overlaid on top of each other. Obviously cut your way through. Don't try and cut both pieces of the material at the same time. I've tried that, spent a few, destroyed another t-shirt in the process, didn't work very well. If you just get in, cut nicely along just one thickness and go all the way around the loop and back to where you started, that's the best way. If you have one of those heavy duty cloth cutting scissors that my grandma used to have, then that's great. I don't have one, so I just use the kitchen scissors. Take your time, and you won't be fraying the edges too much. Then on with one strip, put it out flat. Keep on putting this flat and smoothing it out flat. Now it's joined on the left and the right because it's basically a hoop. Your face is roughly your hand span. So put your hand across your face. You'll see that's about the width of your face. Put it down in the middle, the center line, and just mark 2 panels either side. And then use your thumb on the far edges, top and bottom, to create a width for what will be the straps. Cut out the piece between the straps. Again, don't try and cut both pieces at the same time. Do one at a time, and make sure you don't end up with some skinny little piece of strap that isn't going to help and is going to just snap off. Keep it good and chunky thickness as you cut your way through that. And then putting it on, place it over your nose. Took a couple of practices, but it wasn't too difficult to understand. And the great thing about having used a loop is that you can put your thumbs in the loop, and it's easier to tie them together. It's a bit like tying the top of a plastic bin, where you have those 2 looped handles, and it's much easier to tie a knot in that way. So the first knot is the one that's round the back of the head. Has to be quite tight so it doesn't slide off the back. For ladies who have a sort of bun on the back of the head, that's easy because they just put it just above that small bun. But for us gents or ladies without any buns, do it quite tight round the back. And then the really strong one is the one that you can see in the reflection in the mirror there, is you put your thumbs in the lower straps, pull them out, pull your hands backwards a bit, up behind the ears, and then right on top of your head. So yes, it's not the most pleasant looking device. It looks a bit crazy, like something out of a horror movie, but it actually really works. And because you have these loops, you can tie a really nice tight knot on the top. So I was quite surprised that this actually seemed to work. It gives you a double thickness mask, and to reiterate, the purpose is to stop you touching your face. And in that respect, I think the mask works pretty well. A good point from my son, he was saying, do let them all know that get it on your face correctly and tightly and securely before you go out, if you're going to the shops, wherever you're going, so that you're not spending all your time correcting it and fixing it back on again, because of course that defeats the whole object, which is to not be touching objects that others who have the virus might touch and then touching your face. As Dr. Price said, try and stop hand to face. Thank you very much indeed.